Now you're going to discover what you've never been told about hemorrhoids before, and these findings may surprise and even scare you. The truth is, these small swollen veins can become a big problem if not treated with the urgency they deserve. From the simple straining during bowel movements to more complex issues like pregnancy, various factors in our daily lives can contribute to the onset of this unbearable discomfort. Have you ever wondered why some people suffer from the dreaded hemorrhoids? This condition, often uncomfortable and even painful, is the result of a combination of factors. In this practical guide, you'll learn how to get rid of hemorrhoids once and for all with simple tips that you can start implementing right now if you're watching this video and experiencing pain.
According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, hemorrhoids are a fairly common condition, affecting a significant proportion of the population. Up to 75% of men and women may have or will have hemorrhoids at least once in their lifetime. This indicates that hemorrhoids are a widespread condition, and many people around the world face or will face this problem at some point in their lives. Hemorrhoids can manifest in different ways and with varying degrees of severity, from mild cases that resolve on their own to more severe cases that may require medical intervention. Hemorrhoid symptoms may include itching, pain, bleeding during bowel movements, and a sensation of swelling or protrusion in the anus. These symptoms can be uncomfortable and interfere with the quality of life of affected individuals. And that's not all. Data from the World Health Organization, WHO, indicate that hemorrhoidal disease is a condition that significantly affects the population, especially as people age. Statistics reveal that about 50% of people aged 50 or older are affected by hemorrhoids. This percentage highlights the considerable prevalence of this condition among the elderly and underscores the importance of being aware of the symptoms and seeking treatment when necessary.
As we age, various changes occur in our bodies that can increase the risk of developing hemorrhoids. Factors such as weakening of muscle and vascular tissues, increased intra-abdominal pressure due to age-related health problems, and reduced mobility can contribute to the development or worsening of hemorrhoids. It is essential to understand that although hemorrhoids are common among the elderly, they should not be considered an inevitable part of aging. There are several preventive measures and treatment options available to help manage this condition.
So, what are the typical symptoms of hemorrhoids? What exactly are hemorrhoids? Imagine the anus as a delicate structure surrounded by folds of tissue resembling curtains. These folds play an important role in regulating the passage of feces and maintaining the integrity of the anus.
Now, it is in this scenario that hemorrhoids arise. They are essentially swollen veins that protrude from the anal folds. When you perform your personal hygiene, you may feel this small swelling, often accompanied by bleeding or pain. It's as if one of these veins is trying to get your attention, saying, "Hey, there's something wrong here."
And that's what sets hemorrhoids apart. They are not just a temporary nuisance. They are a condition that needs to be recognized and treated properly. When you touch this area, you may notice that the swelling is soft and elastic, yielding to finger pressure but still noticeable. What causes hemorrhoids? Well, there are several causes. Some of them will surprise you.
Heredity plays a significant role. If someone in your family has hemorrhoids, you have a higher chance of developing them as well. Additionally, obesity is a significant factor. The extra weight puts additional pressure on the anal veins, contributing to the development of hemorrhoids.
Hemorrhoids, also known as piles, are caused by a variety of factors that increase pressure on the veins of the rectum and anus, leading to their development. These factors are often related to lifestyle habits and conditions. Let's understand how each of them contributes to the onset of hemorrhoids. Straining during bowel movements, as is especially the case with constipation, increases pressure on the veins of the rectum and anus. This additional pressure overburdens the veins, making them more likely to dilate and develop hemorrhoids. Therefore, it is essential to avoid straining during bowel movements and adopt habits that facilitate bowel movements, such as maintaining a fiber-rich diet and drinking plenty of water.
On the other hand, chronic diarrhea exerts constant pressure on the anal muscles, which also favors the onset of hemorrhoids. The frequent and liquid flow of feces can irritate and inflame the veins of the anus, increasing the risk of developing this condition. Therefore, controlling diarrhea through a balanced, fiber-rich diet is essential to prevent hemorrhoids. Additionally, factors such as obesity can increase pressure in the gastrointestinal region, including the veins of the anus and rectum. Abdominal fat accumulation and increased intra-abdominal pressure contribute to the development of hemorrhoids. Maintaining a healthy weight through a balanced diet and regular physical activity can help reduce this risk.
Lack of physical activity or sedentary lifestyle compromises blood circulation and favors the accumulation of blood in the veins of the anus and rectum. This makes these veins more prone to dilate and form hemorrhoids. Regular exercise, such as walking, is important to improve blood circulation and reduce the risk of developing this condition. During pregnancy, increased blood volume and uterine growth exert additional pressure on the veins of the abdomen and pelvis. This can compress the veins of the anus and rectum, increasing the risk of developing hemorrhoids. Hormonal changes during pregnancy also contribute to vein relaxation, making them more susceptible to dilation. Adopting measures to relieve pressure on the veins, such as avoiding long periods of standing or sitting and maintaining a fiber-rich diet and adequate hydration, can help prevent hemorrhoids during this period.
A low-fiber diet can lead to constipation, making the bowel movement process difficult and increasing straining during bowel movements. This, in turn, increases pressure on the veins of the anus and rectum, raising the risk of developing hemorrhoids. Consuming fiber-rich foods such as fruits, vegetables, whole grains, and legumes is essential to maintain soft stools and facilitate bowel movements, thus reducing the risk of hemorrhoids. Prolonged sitting on the toilet can increase pressure on the veins of the anus and rectum, especially if there is no immediate bowel movement. This can result in excessive straining during bowel movements and increase the risk of developing hemorrhoids. Establishing a regular bowel movement routine and avoiding staying on the toilet longer than necessary can help prevent the onset of this condition.
But all is not lost. There are measures you can take to prevent and alleviate the symptoms of hemorrhoids. One of the most important aspects is maintaining good intestinal health. This includes a fiber-rich diet to prevent constipation and ensure regular and smooth bowel movements. Additionally, small changes in the bathroom can make a big difference. For example, using a stool can help raise the knees and align the rectum more effectively during bowel movements, reducing the need for excessive straining. There are some simple measures you can take to relieve hemorrhoid pain at home. A sitz bath, for example, can provide temporary relief by reducing inflammation and soothing the affected area. Soaking in warm water for a few minutes can help relax the muscles and alleviate discomfort. It is important to note that this tip is valid after the first 2 days.
This is a simple and effective technique for relieving hemorrhoid symptoms. Here are some ways to prepare a sitz bath at home. Hot water sitz bath. Fill a basin with warm water. Sit in the basin for about 15 to 20 minutes, twice a day. The water should be warm, but be careful not to burn yourself. You can also make an aloe vera sitz bath. Heat the water to a comfortable temperature and pour it into a basin. For every liter of water, add a tablespoon of aloe vera gel. Make sure the gel dissolves in the water. Stay in the sitz bath for 15 minutes. Additionally, applying ice may be effective in reducing swelling and pain associated with hemorrhoids. Wrap a few ice cubes in a clean cloth and apply to the affected area for a few minutes at a time. This can help numb the area and reduce inflammation, providing temporary relief. But don't overdo it.
Lifestyle changes are essential. Have a fiber-rich diet. Consuming fiber-rich foods such as fruits, vegetables, and whole grains can help soften stools and reduce pressure on the veins of the rectum and anus. If you suffer from intestinal problems or want to prevent the onset of hemorrhoids, watch our video about a powerful, natural, and nutritious detox juice that can help cleanse the intestines right now and promote digestive health. Click on the pinned card and discover this simple and effective recipe to keep your digestive system healthy, preventing discomforts like hemorrhoids.
For those with hemorrhoids, some foods are recommended to help alleviate symptoms and keep the intestine functioning well. Whole grains, such as brown rice, whole grain pasta, and whole grain bread, are good options because they contain plenty of fiber, which aids digestion. Seeds, such as pumpkin, chia, flaxseed, and sesame seeds, are also rich in fiber and can help regulate the intestine. Fruits with peel, such as watermelon, orange, kiwi, mango, persimmon, tangerine, and papaya, are excellent sources of fiber and vitamins. Vegetables such as lettuce, tomato, arugula, watercress, spinach, chayote, and pumpkin are light foods rich in fiber that aid digestion.
Nuts, such as peanuts, walnuts, almonds, and chestnuts, are good options for healthy snacks as they provide fiber and healthy fats. Healthy fats, such as olive oil, avocado oil, and flaxseed oil, can help keep the intestine functioning well. Legumes, such as beans, chickpeas, lentils, and soybeans, are sources of protein and fiber. Lean proteins, such as chicken, fish, eggs, turkey, and tofu, are important for a balanced diet. Low-fat dairy products, such as skim milk, white cheeses, and skim yogurt, can provide calcium and protein without adding too much fat to the diet.
It is important to include these fiber-rich foods in every meal of the day to help keep the intestine healthy and prevent constipation. Prefer to consume raw fruits and vegetables whenever possible, as they have more fiber than when cooked. Another golden tip is constant hydration. Drinking plenty of water can help prevent constipation and reduce pressure on the veins of the rectum and anus. The amount of water a person should drink may vary depending on various factors, including body weight and level of physical activity. However, generally, it is recommended to drink between 2 to 3 liters of water per day. For people with constipation, adequate hydration is especially important, as water helps soften stools and facilitates their passage through the digestive tract.
Additionally, if you're increasing fiber intake to help with constipation, it is important to increase water intake as well, as fiber absorbs water and can help form softer stools that are easier to pass. Another lifestyle change is regular physical activity, which can help prevent constipation and reduce pressure on the veins of the rectum and anus. However, if these measures are not effective or if symptoms persist, it is important to seek medical advice. Your doctor may recommend additional treatment options, such as topical medications, minimally invasive procedures, or, in more severe cases, surgery.
For those seeking quick relief from symptoms, there are topical treatment options to consider. This includes the use of specific ointments and creams for hemorrhoids, which can help reduce inflammation, relieve itching and pain, and promote healing. These medications often contain ingredients such as corticosteroids, anesthetics, or vasoconstrictor agents to help relieve symptoms. However, in more severe cases or when symptoms do not respond to topical treatment, more invasive procedures may be necessary. 2 of the most common procedures are rubber band ligation and hemorrhoidectomy. Rubber band ligation involves placing a small rubber band around the base of the hemorrhoid, cutting off blood flow to the area. Over time, the hemorrhoid shrinks and falls off, providing relief from symptoms. Hemorrhoidectomy is a more invasive surgical procedure in which hemorrhoids are surgically removed. This is usually reserved for more severe cases or when other treatments are not effective.
To diagnose and classify hemorrhoids, doctors may perform a physical examination, which may include visual inspection of the anal area and the use of an instrument called an onoscope to examine the inside of the rectum and anus. Based on the symptoms reported by the patient and the findings of the physical examination, hemorrhoids can be classified into different grades of severity, which vary according to the size and location of the hemorrhoids. Once diagnosed, hemorrhoids are often classified into different grades according to the severity of symptoms. In grade 1, hemorrhoids may be small and internal, often causing no noticeable symptoms.
In grade 2, hemorrhoids may be external, protruding from the anus during bowel movements but retracting spontaneously. In grade 3, hemorrhoids may protrude from the anus and need to be manually pushed back in. In grade 4, hemorrhoids are permanently protruded from the anus and may cause intense pain and bleeding. Additionally, it is important to understand the factors that can worsen the condition of hemorrhoids.
Irritating foods, such as condiments and peppers, can increase inflammation in the anal region. Stress also plays a role, as it can lead to excessive contraction of the anal muscles, making it difficult for blood to flow and increasing the risk of hemorrhoid inflammation. It is important to alert you to the impact that food and stress play in this process. Irritating foods, such as spicy condiments and caffeine-rich foods, can increase inflammation in the anal region, exacerbating hemorrhoid symptoms. Excessive consumption of these foods can lead to additional discomfort and may even worsen the condition of hemorrhoids, making moderation and choosing a softer diet essential to alleviate symptoms.
Stress can be a major contributor to worsening hemorrhoids. When we are stressed, we tend to contract the anal muscles, which can increase pressure on the veins and lead to inflammation. Therefore, finding ways to manage stress, such as practicing relaxation techniques, physical exercise, or seeking psychological support, can be crucial for controlling hemorrhoid symptoms. It is crucial to seek medical attention if you are experiencing the following hemorrhoid symptoms. Persistent anal bleeding. If you notice persistent bleeding during or after bowel movements, it is a sign that deserves attention. Bright red blood in the stool or on toilet paper may indicate the presence of hemorrhoids.
Intense and persistent pain. Pain, especially if it is sharp and persistent, may be a symptom of hemorrhoids. If you experience significant discomfort in the anal region, it is important to seek medical advice. Rectal prolapse. This occurs when part of the rectum protrudes from the anus. If you notice this symptom, it is essential to seek medical evaluation and treatment. Changes in bowel habits. Changes in usual bowel movement patterns, such as constipation or diarrhea, may indicate the presence of hemorrhoids. If you notice any significant changes in these habits, it is advisable to consult a healthcare professional. Presence of alarming symptoms. This may include anal itching, difficulty in defecating, and the presence of mucus in underwear or bowel movements. These symptoms may be indicative of hemorrhoids and should be discussed with a doctor.
Additionally, it is essential to seek medical attention if symptoms do not improve with home treatment or if you have hemorrhoids and are over 50 years old, especially if you present abnormal symptoms such as weight loss and abdominal pain.
The doctor specialized in the diagnosis and treatment of intestinal diseases, including hemorrhoids, is the proctologist, also known as a coloproctologist. This professional has experience in dealing with a wide range of conditions related to the large intestine, rectum, and anus, including hemorrhoids, anal fissures, diverticulitis, among others. If you are experiencing intestinal problems or symptoms related to hemorrhoids, it is recommended to consult a proctologist for proper evaluation and treatment.